Welcome to Talk 1260 KTRC. This is the Humanity Behind the Vanity. Dr. Daniel Ronel talking with my wife Betsy.
Hello.
About the realities behind plastic surgery. We've got a great show today, a nutritional tip by Mark Wood. And I wanted to thank our generous sponsors, the makers of Artifil and iFlow, the makers of the OnQ Pain Buster.
And you know, I would actually put a shout out to them and tell everybody, request that pain pump. You have no idea. If
Insurance will cover it.
Insurance covers it. It's not out of pocket to you. Milk that insurance company for everything they're milking you for.
If you're getting a GYN procedure, an orthopedic procedure, general surgery.
It's a tiny, tiny, tiny tube, probably the size of a little bit bigger than the size of a pinhead.
Right.
And I mean, it delivers anesthetic right to the
site
incision.
of surgery.
Exactly. I mean, you can't get any better than that. I had it.
So ask your doctor to request the pain pump.
Yeah.
And if you have any questions, obviously you can call my office and I'll put you in touch with the right person. But
it's a great product, and you should just ask for it. Again, get all you can out of the insurance company because they're getting all they can out of you.
Right.
So, yeah, iFlow pain pump, truly.
Okay.
I'm going to ask for it for my next C-section one day. All right, anyway, on to the show. So we have a funny kind of show today. I watch all these, what some people call frivolous and silly shows and magazines, like People Magazine, Us Magazine, Access Hollywood TV show, E! Entertainment. I watch all those shows. I think they're fun, and, you know, whatever. I never pretended to be an intellectual, so.
You don't have to be intellectual. I mean,
I'm just saying, in Santa Fe, some people are like, oh, I would never watch such a show. I do. I'm out and proud. I think they're fun.
I've seen that show, too.
Yeah, I make you watch some of them. They're great.
They're interesting.
Look, they tell you another slice of life. It's not all about, you know, the latest gang fight in Albuquerque. I don't watch that. I would rather watch something, to me, that's more interesting and fun and light. But anyway, this week, a young woman who has become famous, and no one is sure why. Her name is Heidi Montag, I think. I know her last...
I've heard her name.
Yeah. And the joke about her is that nobody knows why she's famous. She was on that show, The Hills, that was on MTV, that has made a couple of young girls somewhat famous. And I didn't watch the show, so I'm not familiar with it. I just noticed her because Heidi has been in the news all week. She's been on the cover of People Magazine this week, too. I think she's fantastic looking now after her procedures. She had what people are saying to be 10 plastic surgery procedures in one go under anesthesia. She's 23.
She's young and healthy.
Exactly. From what the reports
say,
she's totally healthy.
What are the 10 procedures?
These are the 10 procedures, and I wouldn't call them all procedures, but again, to make news, this is what's come out. So we're here to sort of narrow it down and make it normal. Okay, the 10 procedures she's had are Botox in her brown forehead.
It doesn't count as a procedure.
Yeah, please.
Yeah.
Fat, her own fat, injected into her lips and her cheeks.
That doesn't really count as a procedure.
No, she had her ears pinned back, which is a very normal procedure.
That's an otoplasty. That's a quick, easy procedure.
Isn't it in office?
Usually not.
Oh, not? Okay, I don't know about those things. Okay. So, and then she had, here's the big ones. She had her chin reduced. So that they had to saw off her chin bone.
That's a serious procedure.
Right, that's pretty darn serious. Then she had neck liposuction, which goes with that kind of procedure because you're already in there. Then she had her breasts redone. She made them bigger.
Remove and replace breast implants.
Right. She said she corrected. She said it was revisional surgery, but she also obviously wanted to go much bigger.
Okay.
She's like porn star big now, and she admits that wholeheartedly.
Is she thin?
She is thin, and she's small. And she had inner and outer thigh lipo, and she had a buttock enhancement, but it didn't say she had an implant, so I don't know how it was enhanced. Maybe her own fat was put there, I don't know. She doesn't have much fat, but whatever there was.
So far that doesn't sound like too many procedures all
at once. This is just the media making something out of nothing, so I thought this is exactly what our show does, which is normalizes the situation.
I mean, I think a number like 10 procedures at once, that's a serious thing, and
if they're real procedures.
Right, you don't want to do too many procedures at once because that, number one, increases the time in the OR, and
under anesthesia.
Number two, whenever you combine true medical procedures, the risks of each procedure goes up a little bit. So, for example, if you combine an abdominoplasty with a breast augmentation, although the risks of each procedure are low, when you combine them, the risks of each procedure goes up a little bit. It's still low. So if you start to add too many procedures at once, then you're starting to really have to select just the right patient. A young, healthy patient who doesn't smoke is ideal to have multiple procedures. You wouldn't want to do too many procedures on an older person, or if they smoked, or if they had other issues going on.
Wait, can I just say one thing? I forgot she had a mini brow lift. That's the one I thought was a little weird for such a young person. Anyway, I'm sorry. Okay.
That's okay. I'm not sure what that is, but it does not sound like a deep,
No,
serious,
it's not. But I
long-
just, for a 23-year-old, you know. But whatever, it's her personal choice.
Some people may have low brows.
She looked for her, in my opinion, which doesn't count in her surgery, she looked fine. Now, but I see the difference it made, and she looks great.
And we're not talking about her as a person. We're just talking.
Right.
We're using her as an example of what does it mean when you have many surgeries all at once.
So let's look at the procedures she had done. I'm going to go over them one more time because I left that out.
Okay.
So she had a mini brow lift.
Yeah.
She had Botox in her brow and forehead.
Right.
If that makes sense. In her frown lines and forehead. She had fat injections in her lips and her cheeks, and I think her nasal folds. She also had inner outer thigh lipo.
Mm-hmm.
She had a buttock enhancement, and she had breast revision and enhancement.
Okay.
Is that 10? And ears pinning.
Okay.
Ear pinnings.
I don't know, and it doesn't really matter what the number is,
I know,
as long as if she has a bunch of small procedures by one or more than one doctor at the same time with a team that works very well and very efficiently, then that's fine. She probably did not spend a lot of time in the operating room.
No, and she has a great plastic surgeon. His name is Frank Ryan in Beverly Hills, somewhere in California. And he's all over the news, too. He's a very respectable surgeon, so he would not do anything dangerous. You notice we never hear about, like, these total extremes, like the Catwoman, or, may he rest in peace, Michael Jackson's surgeries that made him look in his exaggerated form. We never hear who did those plastic surgery procedures, but you will hear about someone who's doing something that is normal and within the realm of reasonability.
Okay. And one thing that you raised is she had the removal and replacement of her breast implants.
They're huge now.
Okay,
a triple D. Porn star. Okay. But this is her choice. She wants to look a certain way, and she has said that.
She's probably going to have, on average, 8 surgeries in her lifetime to revise
she
these
seems
and
to know
redo
that
it.
too.
So I still have an issue with making breasts that are way too big and out of proportion for the body, and it's important when I do a consultation for breast augmentation, I take anatomic measurements and you measure the envelope of the breast, and I think it's important for people to understand if they go bigger than that, they'll have a higher risk of complications. And she may too. I don't wish them on her, but I understand that...
Well, you have a little frame supporting a big
most
item.
people should not be getting breast implants that big.
Right. But she wants to look a certain way. So.
And that's okay. That's her choice. As long as she does it with open eyes, that's fine. But also, you have to look at where they're having their surgery done and who's doing the surgery. I'm taking care of a woman now who just got back from Mexico who had a combination of procedures, and she's having a lot of complications because of that.
Right, so it's about who the doctor is, it's about your health, which you're responsible for,
right,
and God, all mixed into one.
right.
So, interesting.
Okay.
But, yeah, okay.
Well, we have to wrap things up
this segment up.
for this thing. Thank you for listening. Coming up next is a nutritional tip by Mark Wood, and please stay tuned. We'll be back in a few minutes. You're listening to Talk 1260 KTRC, the Humanity Behind the Vanity. We'll be right back.